Hello, everyone. Welcome to Leisrealtalk. I hope everyone is doing well. Well, I'm glad that I made it to my live stream because I wasn't feeling very well today. As I was working on the bird flu, I think I got a virtual infection by the amount of information on the flu. I have been feeling cold all day today and fighting the cold symptoms. But anyways, I'm here. All right, let's get started because there should be a lot of information to share with you. All right, well, YouTube just told me that I'm live. Well, thank you, YouTube. Okay, so where are we? All right, so last week, last week, Saturday, I showed you how the Chinese people are discovering their country's population crisis as the streets grow emptier and people disappeared en masse. They ask, where did everyone go? And then the Saturday before that, on February the 22nd, I discussed the large number of deaths, overwhelming funeral homes and crematoriums in China. When you put the two together, you get a dreadful picture of China's public health crisis. The truth is, there's a deadly outbreak in China, but the Chinese government refuses to tell people what it is. After some research, I believe a deadly avian flu is contributing to China's massive deaths. Today, a science news portal, it's fist.org. Hold on, let me show you. Yeah, fist.org. Maybe I could do this. Yeah. They had an article, and it's a science news portal. They had an article today, written by three people, and it's saying that H5N1 bird flu is a looming global health threat. I believe it's time for the world to take China's outbreak seriously and recognize that the Chinese government has been covering up human infections of the deadly H5 avian flu. So let me first, before I talk about China, I want to first tell you a little bit about H5N1 in the US. Well, there's, H1N1, various different types of avian flu, but the deadliest for humans is the H5N1. So H5 type avian flu typically spreads among birds and poultry, posing minimal threat to humans. I mean, it's just not. When humans get it, it's deadly, but it's just not easy for birds to pass it on to humans. However, in 2024, an unusual event occurred in the United States. A new strain of H5N1 began spreading among dairy cows. Ordinarily, an H5N1 outbreak is accompanied by mass deaths of wild birds and poultry. However, this time, there was no such warning. Instead, the virus silently appeared in cattle and spread among them. This is highly unusual or abnormal, leading some individuals to speculate if it originated from a lab. Although its exact origins remain unclear, the US CDC has confirmed that this is a new strain of the virus. Some people who had direct contact with infected cattle also contracted it, but their symptoms were mild. However, the concern is growing now because the virus has spread to domestic animals like cats, as well as other mammals, even lions. I've seen a CDC report that listed all the states, and then the date and also the type of animals that were infected. And I saw lions. So H5N1 is highly lethal to humans with a 50% fatality rate, meaning 1 in 2 infected individuals dies. The virus also causes severe symptoms such as severe pneumonia, respiratory failure, and multi-organ failure. The greatest concern is that if H5N1 mutates to spread easily among humans, it could trigger a global pandemic with an extremely high fatality rate. It means that a mass number of people will die. While human infection of the H5 bird flu is lethal, cover-up of the information is more deadly. And I'm afraid that's what's happening in China. So now let me talk about China. H5 type bird flu hit multiple Chinese provinces, including Shandong, Henan, Hebei in January, and has been spreading since. Once again, the authorities are choosing to remain silent, or almost silent, avoiding public acknowledgement whenever possible. But people could still get a clue. For example, in Shanghai, people suddenly discover that live poultry sales have been banned until the end of 2027. And the decision to shut down all live poultry markets across the city has sparked widespread speculation if the authorities are concerned with human infections. People are not just worried about the shortages of eggs and chicken, but rather the fear that the virus may mutate from infecting only animals to humans. And human infections have indeed broke out. Shanxi Province became the epicenter where human infections skyrocketed. On February 11th, an employee from China's CDC privately confirmed that human H5N1 infections had been detected in Shanxi, but he refused to disclose the exact number of infections or deaths. However, in Thailand, a Thai health news source had reported the leaked details. And according to a staff member at the Shanxi CDC, the province has seen 2,000 confirmed human infections and 300 deaths caused by H5N1 infections so far. Now, this was also reported by Chinascope, which is a news portal dedicated to China news. Although CCP-controlled media has remained completely quiet, observers tracking local Shanxi reports notice that since mid-January, disease control centers across the province have been going all out conducting quote-unquote human avian influenza surveillance programs, right? Well, if there's no human outbreak, well, why would they go all over the province to conduct such surveillance program? And in mid-January, the Chinese edition of the Epoch Times interviewed a Chinese epidemic an insider working for, I think, Chinese Epidemic Control Organization. This person remained anonymous, but he confirmed that he had personally encountered over 100 human cases of H5N1, and fatality rate, according to him, was as high as 68%, meaning that out of 100 infected people, nearly 70 had died. He also reviewed that China's current vaccine development efforts are primarily focused on H5N1. And this is what he said. He said, don't waste your time looking at the official reports. He said, there are multiple respiratory diseases circulating right now, collectively referred to as X disease. If you see an outbreak, consider the possibilities of a COVID variant, human metapneumovirus, or H5N1. He said, without a doubt, H5N1 is going to be one of the most formidable viruses in the future. And he said, H5N1 is already spreading on a large scale and is basically out of control. The authorities will announce it soon. Quarantine zones are being built rapidly along highways. The same person disclosed that multiple provinces in China have quietly prepared new quarantine facilities, infamously known as Fangchang, right? They're called the makeshift quarantine camps. The CCP built large numbers of Fangchang Hospital or these quarantine camps during zero COVID days. The truth is, they never disappeared completely and are waiting to be reopened for the next wave, for the next pandemic to arrive. The person also said that the Chinese authorities do not dare to openly warned the public about the outbreak, fearing that the panic could trigger economic instability and international scrutiny. So he said the government is afraid that mass panic will disrupt the economy and that foreign media will criticize them, so they are avoiding high-profile countermeasures. Well, this person also gave some medical advices to the Chinese. He said, treat symptoms immediately, or they will develop into severe illness or even death. He said, if you get infected and feel unwell, take antiviral medication on the same day, regardless of the strain, before seeking medical treatment. So that's the medical advice he gave. So based on that, it's obvious that Beijing is quietly preparing for an escalating H5N1 crisis while deliberately downplaying the severity to avoid public panic. However, covering up the outbreak has consequences. It has been reported that Chinese farmers continue to sell infected animals. A poultry farm from Jiangsu told the Epoch Times that 10 farms in his town had been hit by avian flu, but instead of culling the infected birds, they sold the sick birds into the market because no public health officials tried to even intervene, right? Because people try to downplay the outbreak. A disease prevention officer from Shandong, China, made a chilling statement in a video on January 19th. Well, actually, I have a image of that. Where is that? Oh, I think this is the one. Yeah. So he said, can you guys see? Maybe make this bigger. Yeah. So yeah, this was some text. People pulled the text. So he said, if H5N1 reaches epidemic levels, according to the WHO, every household will experience death. The real challenge will be survival and caregiving. It is unimaginable what an unprecedented pandemic like this could bring. And then on the next day, January 20th, he issued another warning. He said, after Lunar New Year, multiple viruses will spread and cross-infections will occur. Children and the elderly must be especially cautious and prepare for prolonged exposure to viruses. The wave of outbreak may resemble the Omicron outbreaks at the end of 2022. Remember, at the end of 2022, China went through a period, a few months, where the entire country was shut down because, almost everyone got COVID, Omicron, and the mass number of deaths overwhelmed the funeral homes. Remember that? So he's saying that this wave of outbreak may resemble what happened at the end of 2022. He also warned that an advanced mutation of H5N1 could enable human-to-human transmission and suggested that outbreaks of plague, COVID, smallpox, and HIV may emerge. Okay? All right, so that's what we've heard. Now, so how is the CCP going to handle it? Well, beyond covering up the outbreaks, Beijing is also suppressing information about human cases of H5N1 infections. On January 16th, a synopsis of a decade-old research paper on H5N1 briefly appeared on Chinese social media. Somebody posted an old research paper that was originally published in 2014 and was written by a leading expert in animal infectious diseases, Professor Liu Xiufan at Yangzhou University. Now, apparently, Professor Liu is a leading scholar on animal infectious diseases. However, shortly after the paper was posted on social media, the download page returned to a 404. You know what? You know what 404 is, right? So it's unsearchable. Let me come back. And then not only the page was unsearchable, the synopsis was also removed. So basically, this old research paper on H5N1 suddenly became, from a decade ago, it was an old paper, suddenly it became a banned document in China. And then according to a full copy of the paper obtained by the Epoch Times from sources inside China, the first paragraph of the paper revealed 3 critical pieces of information. The first one says H5N1 first broke out in 1996 among geese in Guangdong, China. And the second is the virus later spread to 63 countries and regions across Asia, Europe, and Africa. Between 2003 and 2004, 16 countries reported a total of 667 confirmed human cases, with 393 deaths. So the global fatality rate, during that time, for H5N1 was as high as 58.9%. So it's obvious that the paper was banned in China because it confirmed that H5N1 first broke out in China and spread to 63 countries. And now it's more countries, right? Because at the time, the professor didn't mention North America, but now it's in North America. And also, he also confirmed that it's seriously deadly if humans, in fact, get it. So the CCP doesn't want those pieces of information to be disclosed to the public. So the CCP not only builds quarantine camps, deletes research paper, it's also laying the groundwork to shift the blame. While state media remains silent on China's outbreaks, CCTV has been actively reporting on avian flu outbreaks in other countries, including South Korea, the United States, the United Kingdom, and Japan. Of course, these outbreaks are among the animals are not human outbreaks. The Chinese media also reported the Chinese government's strict measures, such as import bans on foreign animals, to be proactive. So, for example, when Puerto Rico, a U.S. territory, reported an H5N1 outbreak to the World Organization for Animal Health earlier this year, the CCP's General Administration of Customs and Ministry of Agriculture immediately issued a directive to ban poultry imports from Puerto Rico to prevent the virus from entering China. However, no similar announcements or anything were made regarding the outbreak spreading in China. Recently, China's state-run CCTV aired a report citing a former WHO spokesperson who claimed that since the United States withdrew from the WHO, information sharing about avian flu has become more challenging. CCTV used this report to highlight the fact that the United States has nearly over 97% of the H5N1 human cases reported in the world. So according to official statistics, globally, there have been about 68 human cases of H5N1 in 2024 and early 2025. With 66 of them occurring in the United States. So it seems that the US has almost all of the world's human cases of H5N1, and China isn't anywhere near the US in terms of the scale of the problem. So this is classic CCP propaganda, right? A blame-shifting tactic. So it completely ignores the thousands of human cases within China. It only reports US infection numbers. It cites a WHO statement to sound official, credible, or even neutral. And when the outbreak in China can no longer be covered up, guess what? The CCP will blame the United States for the global H5N1 crisis, because you could tell that its media, it's already laying the groundwork for that. But privately, the Chinese leaders know it's already out of control and are seriously concerned with the looming public health crisis. And they have issued National Emergency Response Plan to prepare for a doomsday outbreak. On February 25th, the CCP's Central Committee and the State Council jointly issued the National Emergency Response General Plan to local governments. The plan defined an emergency as a sudden occurrence that causes serious social harm, requiring emergency response measures to address natural disasters, accidents, public health crisis, and social security events or stability events. Now, previously, on February the 2nd, the central government warned of major earthquakes and catastrophic disasters and required 9 provinces to stockpile supplies. Now, you have to understand it's rare for CCP to issue public warnings on catastrophic disasters. So experts say the reason the CCP issued 2 warnings or public statements or policies in 1 month, it means that maybe the Chinese authorities may have internal reports forecasting a massive earthquake in a certain region, but are concealing the information from the public. Or the second is it's an effort. It's an effort to prepare for other large-scale crises, such as a major public health event. So these unusual warnings and preparations suggest heightened anxiety within the leadership regarding potential disasters. On February 27th, CCP's Joint Prevention and Control Mechanism of the State Council issued a notice that instructed local government to proactively prepare for spring epidemic control and strengthen monitoring of acute respiratory infections and surveillance of COVID-19. That's standard language, but most importantly, that notice admitted the emergence of new infectious diseases, including monkeypox and human cases of avian influenza. So it's officially acknowledging that human cases of avian influenza is happening, and the local government should take precaution. However, the authorities downplay the severity, claiming that the outbreaks remain sporadic and low level. This means the government has been forced to acknowledge human H5N1 cases, but they refuse to disclose key details, right? And then they deliberately used vague language to imply that it's not serious. Meanwhile, in Shanghai, hospitals have begun requiring patients to report any history of contact with poultry. A Shanghai patient shared his experience online. When he visited an emergency room on February the 16th, he noticed a sign at the hospital's I don't know if it's entrance or somewhere, but it lists 4 key conditions that patients must report to medical staff immediately. The first is if they have any contact with poultry within the last 10 days. Number 2 is if they had mosquito bites. Number 3 is if they had contact with confirmed COVID cases. And then they also have to report if they took international travels. So these screening measures suggest that the hospitals are already on alert for human H5N1 infections, despite the government's attempt to minimize public concern. By the way, I want to tell you that China has been preparing for the next wave of outbreak or public health crisis since February of last year. I want to show you a picture. I do have a picture. Yeah, here's a picture. So it started in February 2024, but the what it's called nationwide emergency drills to handle unexplained pneumonia outbreaks. Okay, you can actually see the text on the screen. And the drill, I said, started in February, but the frequency increased significantly in June. And it was this type of drills were carried out throughout China. So when questioned by the media, Chinese authorities downplayed the significance of these drills, claiming they were just routine exercises and not triggered by any special reason. They were, but I think no one would want to conduct this kind of drills across China consistently for months if there was no signs of concern for them, right? So I want to end my program by sharing a video with you that has become, where's the video? Here's the video. Let me make this bigger. This video, people say, is most symbolic of China from 2020 to 2022. One quarantine officer dressed all in white, leading hordes of people in hundreds, if not thousands, marching onto a quarantine camp with their luggages in hand. At the time, Chinese people willingly subject themselves to government quarantine. But do you think the same thing will happen again? I mean, if the government force people to go to the quarantine centers, do you think they will agree to? Will they be as obedient as the ones that we've seen in this video? What do you think? I mean, this video was unbelievable because, let me play again, because, I mean, one man could just dictate the livelihood of thousands of people. I don't know how many people there are, but it looks like it's more than hundreds. And so that's, it's crazy. That just shows you how much people have been brainwashed. And they willingly just follow that guy with their luggages in hand. But I don't think this will happen again in China. I think people would refuse. I think people would refuse to be quarantined. So that's all for tonight. Any questions for me? To be honest with you, I got flu-like symptoms when I worked on this. And I've been drinking water all day. All right, let me see. Let me go through the super stickers first. I'm not a medical expert, so I can't answer any. But what I did is I tried to compile as much information as I can and try to paint a big picture for you. I think there's absolutely human cases of H5N1 outbreak in China, and the world needs to be needs to be alerted on that because it's deadly. It's deadly. It's one in two will die. Charles Womack, when I hear camps in China, I think of Laogai re-education camp. Are these camps different? Well, these are pretty much like Laogai camp because you don't have freedom there. These quarantine camps are, they're not hotels. The living condition, first of all, is not very nice. And then, and then it's very expensive because everything is controlled. Like once you go there, your mobility is controlled. You can't leave until somebody agrees or signs off on your paper. And then the food, and people were complaining about the hygiene state, getting food, getting water, everything could be very expensive. And then the hygiene condition isn't very good. So it is a camp. So it's not a nice place to be and then you have to stay there for a long time. And it's also a way that the local government, the local officials made money, because everything is outsourced, right? Because you have to pay to live there, and so that's a lucrative business for the local officials. But thank you, Charles, for the support, for the financial support. All right, let's see. All right, I think that seems to be all of the super stickers. Mint creative gifts and ideas. Lei, how come this time around the virus is so bad? Is it due to the failure of Sinovac vaccine? Heard that Sinovac is shut down. Yeah, people who the key individuals who worked on the vaccine have been locked up in China. Yeah, the company is investigated, but because there's serious corruption. And also, a number of leading Chinese vaccine experts have died. I don't know if they died from their own vaccine but there were quite a number of them. You know, the quote unquote public health experts who were very outspoken, who were the experts guiding the government during the outbreak, during the COVID outbreak. Quite a number of them have died. Yeah. All right. Okay. Daniel Suguwa, maybe consider having a close source of medical experts to know what they say regarding the info you've obtained about this. Well, I do have I vet the information that I read. There are all kinds of claims out there, but I choose the ones that I think are credible, and many of them do come from medical experts themselves. So, all right. Does the WHO have any additional information on these outbreaks? No, there isn't. I searched, you know, as far as the world is concerned, there's only 68 cases. There are only 68 cases of human cases of H5N1, and 66 of them are in the United States. That's what the information is available. It totally just neglected the outbreak in China. So questions from forwarded by Chris from Vern Doiker in Changchun, going to Beijing the 12th. See no obvious evidence outbreak here. Long lines taxi along entrance hospital nearby all times of day. Is that normal? Long lines of taxi along entrance hospital nearby all times of day. Is that normal? That's not normal. From what I've seen, people are saying that the hospitals are packed. You know, I have seen a lot of videos showing the hospitals are packed. So if you see long lines of taxi, are you seeing the taxi waiting for patient coming out? Long lines of taxi along the entrance hospital nearby all time of the day. Is that normal? I don't know. Are you saying that the taxis are waiting like what we have here, like taxis waiting outside hospital? I mean, hospitals and hotels waiting for people. Is that what you mean? I think that's normal, right? Because if you have a lot of patients, then when they leave, they will need to get a taxi. Someone, Daniel, I would love to see more about this, Lei. Yeah, what I can do is I can copy you the links of the articles that I read, and then you can, and then but they're in Chinese, And then that's my reference. That's your references. Okay. Richard Hingman. Will the CCP make sure H5N1 spreads to the US like they did with COVID-19? I do not know, you know. But I told you I'm being very careful with what conclusions I come up with. But everything I told you, I felt confident in telling you. It's possible, but I think we shouldn't count down the CCP all of a sudden being conscientious about not spreading the virus to other parts of the world. I think if we have that kind of expectations, then we're really, fooling ourselves. I think foreign governments need to take precaution about this outbreak in China, right? So it would be foolish of us. It would be foolish if our governments assume that the Chinese government will be responsible in preventing that from spreading to the US. Whether or not they would intentionally do that, I do not know. But I don't think they would do anything. I don't think they would be responsible to say, okay, let's make this transparent. If they have been transparent, they would have taken care of their own people. So foreign governments need to take care of their people and do something about it. All right. Okay. Somebody asked me, whatever happened about the unlicensed Chinese lab they found in California? I have not followed up on that. It was dreadful. There were well, I don't think that the Californian government. Do you think the Californian government is staying on top of that? I don't think so. I doubt it. All right. Oh, I'll take one more question from this one from Netflix Foreign. You had that talk on HIV in China a while back. How much do you think this has impacted the mortality rate of the flu with the young and middle-aged people? How much do you think this has impacted the mortality rate of the flu with the young and middle-aged people? I'm not a medical professional, so I can't answer that. But I think the HIV outbreak in China is not as severe, and also HIV. If you're HIV positive, you can still live with the virus for a number of years, right? It may not be deadly until the patient develops AIDS. But this outbreak, this is deadly. I've seen so many parents talking on social media about their children die within a day. From the onset of the symptoms to the time when their kid passed away, it's just one day. They barely had any time to react. So it's very fast. So I think it's a different. Although the HIV outbreak is a serious problem in China, I continue to see young people claiming that it's a serious health problem, threatening the young people. All right. That's all for tonight. I think I'll end it here. I will go drink more water and go to bed. All right. Thank you very much for joining me, and I'll see you in a few days. Okay, bye. This doesn't end. Is it end? It doesn't end. Oh, here.